We definitely recommend all vaccines. We definitely recommend keeping your child on the recommended schedules by the CDC, also by the American Academy of Pediatrics. So there's a lot of controversy and a lot of discussion, a lot of anxiety, a lot of fears related to vaccines. So I wanted to take a minute just to kind of talk about vaccines. So vaccines, we give the first round of shots starting at 2 months. Babies will get the same shots again at 4 months and again at 6 months. I like for all parents to know that these vaccines are dosed for a 2-month, a 4-month, and a 6-month-old baby. It is not the same vaccines that an adult gets. So, for example, a pregnant woman will get Tdap. Babies starting at 2 months will get DTaP. Sound a lot the same, but they're not. It is definitely dosed appropriate for a small child. It's very safe. There's 3 injections and then 1 oral vaccine. By oral vaccine, we're not giving a shot in the mouth. It's the rotavirus vaccine. You drink it, tastes like sugar, and it helps protect against a really, really horrible diarrhea. The injections are 3 injections, but there's more than 3 vaccines in the shots because it's a combo shot. The vaccines work together to promote a good immune response. So generally what parents can expect the vaccines to be included at the 2, 4, and 6 month appointments. We have 2 shots that protect against bacterial meningitis. Fun fact, it also helps protect against ear infections. It won't guarantee your child will never get an ear infection, but let's be honest, if it will cut down on our ear infections, that's always a good situation. DTaP is one of my favorites. Not only does it protect against tetanus, which is just something that everybody needs to be kept safe from, it also helps protect against whooping cough. Whooping cough can be especially deadly and dangerous to children under 6 months, which is why we start giving the shot at 2 months. The younger you are, the littler you are, the harder things are on that body. Starting at 11, we do the first round of Menactra, first round of HPV. If we start the HPV series before age 15, it's actually only 2 vaccines. Starting at 16 and on, it will be a series of 3 shots. Both are fine. We have plenty of time to talk about it. The reasons why we started at age 11 is because the immune system is so primed that we have an especially good immune response to the HPV vaccine. I'm very excited about it. It is our first official anti-cancer vaccine that exists. It's helpful for both boys and girls. We've all heard about cervical cancer and other cancers that can happen because of the HPV virus, but this can also happen with boys. The meningitis vaccine is started at 11, and then we give a second booster dose starting at 16. We also give a second meningitis vaccine called Bexsero, which Bexsero combined with Menactra together cover 5 of the most common causes strain-wise of bacterial meningitis, which is a very scary thing. We want to do our best to keep our teenagers safe from that and going forward when they're going to college and going through life. Sometimes parents ask, is it okay to break up vaccines? Can we do an alternate schedule? And my answer to that, I never like to tell parents how to take care of their children. I like for it to be a partnership where I am super pro-vaccine, but I'm also pro-education. I like for everybody to be on the same page. But I do support having all the vaccines given at the recommended times. If you think about it, the more on time we are on vaccines, the earlier we can keep everybody safe. I want you to know that we are taking every precaution necessary. We still want for kids to stay on track with well child checks and their vaccinations and everything, because there is a lot of things that we keep track of that we want to make sure we're on top of, including keeping our children safe from vaccine preventable illnesses. We are very excited about vaccines. Call us to make an appointment. We definitely want kids to stay on track, both with well child checks and vaccine schedules. If you have any questions, we are so happy to talk about it. We get excited about talking about it. We will answer any questions that you have. We are here to answer all of your vaccine questions.